Assalamu alaikum wa rahmatullahi wa barakatuhu. Welcome to the channel of Standard Medical Notes. Today we will discuss about the pathology of the mediastinum and the hila. So let's begin with the name of Almighty. So let's see what are the signs which are seen on chest X-ray in the pathology of mediastinum and hila. Number one is the hilum overlay sign, and number two is the angle border sign. What is hilum overlay sign? If hilar vessels are visible through a mass, if hilar vessels which are present in the hila, if they are visible through a mass is either interior or posterior to the hilum. So if this is the hila left side, and this is the hila of the right side, there are some vessels here. So there will be markings here. So you find something, a well defined whitish opacity here. Now if you are able to see these markings in this whitish opacity, then that means that mass is either anterior or posterior to the mediastinum. It is not in the middle mediastinum. That means it is not in the middle mediastinum. And if they are obscured, then that is in the middle mediastinum. So obscuration of the hilar vessels means the mass is in the middle mediastinum, and if the vessels are visible, then the mass is not in the middle mediastinum. Either it can be anterior mediastinum or it can be in the posterior mediastinum. So if vessels are visible, then it is not in the middle mediastinum. So it is either anterior or posterior. If vessels are obscured, then it is in the middle mediastinal. Okay, that is known as hilum overlay sign. The second is angle border sign. So relationship of mass border with the lung. Relationship of the mass border with the lung. This is the lung, no? If this is the lung, okay. So you see this border. This is the border of the mass and this is the border of the lung. So this is the angle. This is known as the angle border. Angle border. Okay. So if the angle border is obtuse, meaning if it is more than 90 degrees, this is known as obtuse. If it is more than 90 degrees, then it is a mediastinal mass. Okay. So, and if the angle is less than 90 degree, meaning acute, okay, meaning if the border is acute, then the mass is not mediastinal mass, it is a pulmonary mass. So two things we are, whenever there is a mass like thing in the middle of the chest X-ray, mediastinum meaning from the top to bottom in the middle of the chest X-ray. So first you analyze whether it is a pulmonary mass, or mediastinal mass. Okay, mediastinal mass. Number one. Number second, may it be pulmonary or mediastinal. In which compartment? What is the compartment of that mass in which it is present? Whether it is the anterior mediastinum, whether it is in the middle mediastinum, or whether it is in the posterior mediastinum. Okay. So that is about angle border. So angle border sign will say whether it is pulmonary mass or not, and hilum overlay sign will say whether it is in which compartment the mass lies. Okay, so that's about the theoretical part. Now we will see the practical part, meaning the chest X-rays. So you see this X-ray. Okay, so step by step we will analyze this X-ray. So this is equidistant from the clavicles. Okay, and the space between the intercostal spaces are okay, or you can count them 1 2 3 4 5 6. So it is good inspiration, and the vertebrae are very well visible now. Very well. I think it is underexposed, or you can it is overexposed chest X-ray. Overexposed. Okay, that is the technical quality. Now we will divide. So grossly, just you see the X-ray before dividing the X-ray. If you see grossly also, you are able to see a mass like thing here, something, a white opacity. Okay, you see the periphery first, nothing you are seeing. Okay, in the periphery what you do, you divide the lung into zones. So in periphery you are seeing nothing, 1 2 3 zones. Okay, carina you are saying at the right side, left side carina is obscured by this whitish opacity, rounded, like this is more like to be a mass. No, mass is more than 3 centimeter in size. Okay. Now, so because of the counter of this opacity, see the counter, it is more likely to be a mass. It looks like to be more likely. It is not. See, silhouette sign, cardiac silhouette sign is not present. Okay, so this is nothing to do with consolidation or something like that. So it looks like more of a mass. Okay, now we will see whether this mass is pulmonary or mediastinal mass. So for that you need to know angle border sign. So you see this is the pulmonary border. Okay, this is the pulmonary border and this is the border of the mass, and if you measure this angle, this is more than 90 degree. So that means it is a mediastinal mass. It is a mediastinal mass. So one thing we have known that there is a mass which is present in the mediastinum. Now we need to know whether this mass is in which compartment, the mass lies in which compartment. We should know that. So for that, what you see the Hila. Now in the Hila you are able to make out, I think, see, yes, you are able to make out the border of the left Hila. So you are able to make out the border of the left Hila. I will show. So the red arrow you can see, this is the border. I will show this one. So that is nothing but the vessels you are saying. Okay, if you are able to see this margins within the mass, that means you are able to see the Hila within the mass. You are able to see the Hila within the mass. The silhouette sign with respect to the Hilar silhouette sign is absent. Okay, there is silhouette sign with respect to heart. There is silhouette sign with respect to diaphragm. There is silhouette sign with respect to Hila also. But the Hilar silhouette sign is absent here. Okay, that means the mass is not in middle mediastinum. It is either in the anterior mediastinum or in the posterior mediastinum. So how do you know that? You need to take a lateral chest X-ray. By that you will be you will know whether it is in anterior or posterior mediastinum. So we have known from this that is a mediastinal mass which is not present in the middle mediastinum, and these are the memory shadows. Okay, same thing here. If you see this, so the mass is in the mediastinum because it is obtuse angle, blue line. Okay, mediastinum mass. The silhouette of the right hilum vessels, red arrow, is not obliterated by the mass. The mass is therefore either in the anterior or in the posterior mediastinum. So for knowing whether it is a pulmonary mass or mediastinum, you use the angle sign. Okay, angle border sign, and to know whether it is present in the middle mediastinum or not, you use the hilum overlay sign. Okay. Now I'll see the other X-ray. Come to this X-ray now. So grossly, if you see, you are able to make out something here. So peripheries. Okay, we'll go step by step. So you can say that trachea. Okay, so it is underexposed X-ray because the no, it is not underexposed. It's well exposed X-ray. Well exposed because the spine is just visible, and good inspiration, taken in good inspiration, not rotated. So that is the quality. Okay, so now periphery, you divide it into zones to know the periphery. Nothing is you are able to see. One thing you are able to see the left carina very well here. Okay, left carina, yes, this is the left carina. Okay, and this is the lower angle of the right carina. This is the upper, and this is upstairs. Now we will see. So this is how you will say that it is a mass or collapsed lung. So if it is a collapsed lung, then collapse will pull everything towards itself. Mediastinum will be pulled towards the side of collapse. Diaphragm will be tented. There will be crowding of ribs. You are not seeing all those things. This can be a collapsed lung, right lung collapse, and you are able to see the bronchovascular markings here. So it can't be a pneumothorax also, and it can't be a collapse also. So it is a mass. Okay, in pneumothorax, the mediastinum will be shifted, and you will be able to a pleural. You see a pleural line, visceral pleural line. You will be able to see, and you will see increased lucency between the pleural line and the rib cage border. Okay, so those things will be. So based upon the history, if you combine the history with the X-ray, it will be very easy to say whether it is a mass or pneumothorax or collapse. But if you don't have history, just you are interpreting based upon the chest X-ray, then these are the things which will help in differentiating collapse, mass or pneumothorax. Okay. Okay, so let us analyze this thing, this mass. Okay, this is a mass, this is not a collapse or pneumothorax. Okay, so if you draw a line like this and to the lung border like this, okay, then this angle is more than 90 degrees. So it is obtuse, that means it is not a pulmonary mass, it is a mediastinal mass. It is a mediastinal mass. Now the next step is, so whether it is present in middle mediastinum or not. So that thing. So to know that thing, you see the hilum overlay sign, whether it is present or not. You are able to differentiate, you are able to see bronchovascular mass markings here in this mass. That means hilum overlay sign is present, and this arrow is also showing that thing. You are able to make out, I will zoom it in to make it clear. I will zoom it in. Okay, see, now it is clear. You are able to see the markings. Okay, and for to be more clear, see, this is, it is like this. Okay, you are able to make out the Hila. So hilum overlap sign is present. That means the mass is not present in the middle mediastinum. It is either in the anterior mediastinum or in the posterior mediastinum. Oh, sorry. So in one thing I was wrong. So the mass is a mediastinal mass, but the silhouette of we need to see the silhouette of the left hilum vessels. So if you are able to make out silhouette of the left hilum vessels, then you can say that the silhouette sign of hilum vessels should not be present to say that the mass is in the middle mediastinum. If the silhouette of the left hilum silhouette sign is absent, that means the mass is in the, with respect to the hilum vessels, the mass is in the middle mediastinum. So the silhouette of the left hilum vessels, green arrow, is obliterated by the mass. So the mass is therefore in the middle mediastinum. Silhouette is obliterated, of course. Silhouette is like the borders. Okay. So it is a mediastinal mass which is present in the middle mediastinal compartment. Okay. Okay. Anything else? You are able to see here, this is the aorta, this is the pulmonary artery. Here also you are seeing something in the aortic pulmonary window. So that is also in the middle compartment. Okay, aortic pulmonary window. And the left mediastinal stripe, sorry, the left mediastinal, you can see here, is also, the width of the left mediastinal stripe is also increased. Okay, so these are all the findings of this chest X-ray. So it is a middle mediastinal mass because the silhouette sign is present, the hilar silhouette sign is present. Okay. Now you see this mass. So if angle over angle, you see the angle here also you see, and here also you see, it is obtuse. That means it is not a pulmonary mass, it is a mediastinal mass. Okay, and then here also you see this aortic pulmonary window is obscured, and I think it is the same picture. Okay, aortic pulmonary window is filling here, which is present in the middle mediastinum. So that is also one clue. And the silhouette sign is present with respect to the aortic pulmonary window also. This is the aorta. If I mark it, this is the aorta, this will be the pulmonary artery. So silhouette with respect to, because these visceral structures are present in the middle mediastinum. Okay, so this is also a clue that mass is a middle. So this is, so here you can see the again the silhouette sign, hilar silhouette sign is present. So the mass is present in the middle mediastinum. Okay, obtuse angle with the lung, angle border sign is present, middle mediastinal lines are interrupted, silhouette sign, that's it is in the middle mediastinum, mediastinal mass in the middle mediastinum. So what is that mass? We need to confirm it with CT scan or MRI scan. Okay, so I'll see this chest X-ray now. You see this chest X-ray. So you see this chest X-ray. So you are able to make out it is not a collapse. Okay, because everything will be pulled towards the collapse. So you are able to, you just draw a line here and a line here. So it is approximately, or sorry, we draw a line like this, because at this point it is in this manner. Okay, so we draw a line like this. So this is less than 90 degree, this is less than 90 degree, that means it is acute angle. So that means it is a pulmonary mass. What it is? It is a pulmonary mass. Angle border sign is present, it is a pulmonary mass. Now we need to see whether this is in the middle mediastinum. Okay, middle or not. Yes, it will be in the middle mediastinum. You are able to see the hilar silhouette because pulmonary mass. Okay, you are able to see the hilar markings. Okay, hilar markings here you are able to see. The hilar silhouette sign is absent, that means it is in the middle mediastinum and it is a pulmonary mass. Let us see whether we are wrong or yes, we are right. So it is a pulmonary mass, and this is not in the middle mediastinum, sorry. So I need to revise this one second. So if the vessels are obscured, that means silhouette sign is present, then that is in the middle mediastinum. If the vessels are visible, then that means that is in the anterior posterior. So this is not in the middle mediastinum. This is either in the anterior or posterior compartment. And one more clue here is this aortic pulmonary window. Okay, this is in the middle mediastinum, no? Okay. So that was about the mediastinal mass and pulmonary mass. Mediastinal mass and pulmonary mass. We have learned about the difference between the mediastinal mass and pulmonary mass. Now, mediastinal masses by compartment and hilar enlargement. So we have learned about how to identify whether a mass is pulmonary and or whether it is in the mediastinum, which whether it is in the middle mediastinum or in the anterior mediastinum or in the posterior mediastinum by the Hilum overlay sign and the angle border sign. Now we'll know the mediastinal masses by compartment, means whether they are present in the anterior, middle or posterior compartment, and the second topic is hilar enlargement. Okay, so let us see this theory first. So anterior mediastinum, what are the features if something is present in anterior mediastinum? So there will be obliteration of retrosternal space on the lateral view of the chest X-ray. And what will be the differential diagnosis? Remember this as 4 T's. Remember the differential diagnosis as 4 T's. It can be thymoma, or it can be because of thyroid, or it can be a teratoma, germ cell tumor, or it can be terrible lymphoma. So thymoma, thyroid, retrosternal gravity meaning thymoma, thyroid, and teratoma and terrible lymphoma. One more thing to revise, one more time. Thymoma, these are easy because these are present, we know the anatomy. Thymoma, thyroid, teratoma, which is a germ cell tumor. So this is retrosternal goiter, and the next one is terrible lymphoma. 4 T's of the anterior mediastinal mass: thymoma, thyroid, teratoma, and terrible lymphoma. So one classical hint is CT showing fat, fluid, teeth or calcification is diagnostic of teratoma. If in the CT you see fat or fluid or teeth or calcification, so that is teratoma. Teeth, why teeth? Because it is a germ cell tumor, so it can produce anything, no? It can differentiate into teeth also and hair also, something. So it is teratoma. This is a clinical one. So that was about the anterior mediastinum. Now coming to the middle mediastinum. These signs features nothing. So middle mediastinum we have discussed now. Depending upon the Hilum overlay sign, you will know whether it is in the middle mediastinum. So if the Hilum overlay sign means the hilar silhouette sign is present, then the mass is in the middle mediastinum. If the Hilum silhouette sign is absent, then it is not in the middle mediastinum. So that's all. So if it is in the middle mediastinum, so what can be the differential diagnosis? Most common is the lymphadenopathy. Most common is lymphadenopathy. Okay, lymphadenitis can be to infection, inflammation, increased proliferation. Infection, inflammation, increased infection may be TB or tuberculosis, pulmonary tuberculosis. Inflammation, sarcoidosis or some autoimmune diseases. Increased proliferation meaning malignancy. So lymphadenopathy is the most common. Vascular, so aorta is present in the mediastinum, so it can be aortic aneurysm also. Congenital cyst, and at the lower side of the middle part of the chest X-ray, hiatus hernia you can see. So the most common among these is, so the important things which to remember are lymphadenopathy, one thing, second is aortic aneurysm, third is hiatus hernia, and congenital cyst you can remember. So one clinical pearl to remember is hiatus hernia will present as a retrocardiac mass with a gas fluid level, retrocardiac mass behind the heart. So it will present as a retrocardiac mass and it will have a gas fluid level. This will be the fluid and this will be the gas fluid level. That is the feature of hiatus hernia. So lymphadenopathy, what are the common differential diagnosis? Lymphadenopathy can be to infection, inflammation or increased proliferation, or aortic aneurysm, arch of aorta, or it can be thoracic, arch of aorta, aneurysm of the aorta at the arch of aorta or the upper part of the aortic arch. Okay, arch of aorta, that's aortic aneurysm. Then the third one is hiatus hernia, important one, hiatus hernia, that will have air fluid level and will be present behind the heart. Okay, that is about the middle mediastinum. So when the mass is present in the middle mediastinum, the hilar silhouette sign, meaning the hilar vessels, hilar border, we will not be able to differentiate between the hilar border and the mass border. So hilar border is obscured, so that means that the mass is in the middle mediastinum. So posterior mediastinum, so again you need to take a chest X-ray for these two, lateral chest X-ray, and to know whether the mass is in the anterior posterior mediastinum you need to take a lateral chest X-ray. So what are the important differential diagnosis? Neurogenic tumors, posterior, mainly concerning with the spine. The posterior mediastinum is nothing but spine, concerning with the spine and the thoracic aorta. Remember, posterior mediastinum means concerning with the nerves and the thoracic aorta. So neurogenic tumors you can have, and descending aortic aneurysm you can have, and spinal infection. Some abscess can be there, paraspinal abscess, or Pott's disease due to tuberculosis of the spine. They can be there. Okay, so neurogenic tumors like schwannoma, neurofibroma, these are the most common. Schwannoma and neurofibroma, these are the two most common. Schwannoma and neurofibroma are the two most common neurogenic tumors, and descending thoracic aortic aneurysm and spinal infections may be bacterial or tubercular. That is the about the posterior mediastinal mass. So okay, that's about the mediastinum. Now coming to hilar enlargement. Okay, so hilar enlargement can be unilateral. Hilar enlargement you will see as filling of the hila, and it will not have a smooth counter like a mass, but it will be small discrete opacities which will be filling in the hila. You will see the hilar enlargement like this. So it can be unilateral or it can be bilateral. So unilateral, lung cancer is the number one diagnosis, and infection like tuberculosis is the second diagnosis. Okay, because of lymphadenopathy, or it can be because of some lung cancer mass there, because of lymphadenopathy. Okay, so infection and increased proliferation. Unilateral is mostly because of tuberculosis or malignancy. Bilateral hilar enlargement, sarcoidosis is the classical cause, and lymphoma can also present as bilateral hilar enlargement. And so bilateral hilar enlargement, the classical cause is sarcoidosis, which will present as bilateral symmetric bulky potato nodes plus right paratracheal nodes. Bilateral symmetric bulky potato nodes, means lymphadenopathy will be there. Along with that, there will be paratracheal lymphadenitis. So that is known as 1, 2, 3 sign, that is classically seen in sarcoidosis. And remember to differentiate between lymphoma and sarcoidosis. This symmetric word is important. In sarcoidosis, there is symmetric, bilateral symmetric lymphadenopathy, whereas in lymphoma, it is often asymmetric. Often in lymphoma, often it is asymmetric. Okay, that's all about the theoretical part of about the compartment of the different compartments, and what can be the masses that they can be present in those compartments, and Hilar. Just to revise, in anterior mediastinum, to know whether the mass is middle mediastinum, hilum overlap sign is enough. To know whether it is in the anterior or posterior, you need to take a chest X-ray lateral view to differentiate whether it is in the anterior or posterior side. So differential diagnosis of anterior are 4 T's: thymoma, thyroid, teratoma, and terrible lymphoma. Middle mediastinum, it is most common is the lymphadenopathy, and second one is most common the lymphoma. Second one is the aortic aneurysm, and third one is hiatus hernia. Important one, yes. Lymphadenopathy, aortic aneurysm, and hiatus hernia or congenital cysts. Okay, hiatus hernia or congenital cyst in the middle mediastinum. 4 things, 4 here and 4 here. Okay, posterior mediastinum, masses are mainly concerned with the spine. So neurogenic tumors and infections of the spine, may it be tuberculosis or some spinal abscess. Or one more thing is descending aorta, descending aortic aneurysm. Okay, unilateral hilar enlargement, mainly the cause is lymphadenopathy or malignancy, lung cancer and tuberculosis. Okay, bilateral enlargement classically seen in sarcoidosis, 1, 2, 3 sign along with paratracheal lymphadenopathy, symmetric, but it will be lymphoma will have asymmetric lymph node enlargement, and it will be bilateral. So that's about the key features of this mediastinal, anterior, posterior, the differential diagnosis and key signs and features in the chest X-ray of the anterior, middle, posterior mediastinal mass, and the enlargement of Hila. It can be unilateral or bilateral, and what are the causes of that. Remember, sarcoidosis, lymphoma, lung cancer, infection. So I think it is enough for today. So the theoretical part of this is over. In the coming video, we will learn about the practical part, meaning the images we will see. Okay, thank you.